A very warm welcome to today's Sawaal-Jawaab. Tamal Das, who leads the Collective Center Dynamics Lab at TIFR-Hyderabad, is the speaker for today's session. Generally, when one talks of therapeutic strategies against cancer, the attention has mostly been on genetic and biological studies.
Sure.
It is only in the last 20 years or so that scientists have discovered the role of the physical environment of spread cancer. In this Sawaal-Jawaab session, Tamal will highlight some of these discoveries and help us take a look at cancer progression from a completely different perspective. How do the physical properties of the cell and their surroundings affect the cancer progression? One small thing before we begin today's session, please feel free to ask any questions during the talk. In case you are attending this talk online, please post your questions on the video chat. I would like to request someone to begin with the talk.
Okay, Anusila, thanks a lot for the introduction, and it's an honor and privilege for me to give this talk. And what I'll try to do, I mean, it's a very difficult subject, physics of cancer, like what Professor Madhu was telling me, that he has heard almost everything about cancer except the physics of cancer. So, and bridging this, sorry, yeah, I think I'm louder now, yeah. Bridging these two subjects, physics and cancer, is quite difficult, but I'll try my best to sort of simplify this and give you a very simplified view of the things. So before we begin, a little primer on the necessary biology that we need to sort of remember, okay? So our body is basically made up of four kinds of tissues: nervous tissues, muscle tissue, epithelial tissue, and the connective tissue. Now, for our talk, we can safely ignore the nervous tissue and the muscle tissue for the moment and focus our attention to these tissues, which is the epithelial tissue and the connective tissue. One of the reasons we can do that, because cancer is essentially a disease of the epithelial tissue. 80% of the cancer are of epithelial origin. So when I say the physics of cancer, I'm mostly meaning the cancer of the physics of cancer of the epithelial tissue. Now, what is epithelial tissue? There is a very simplified diagram that I'm going to show over here. So these cells are the epithelial cells, and these cells form the cover or the lining of the many of the organs in our body. If you think about skin, that is an epithelial tissue. If you think about the entire GI tract, that's an epithelial tissue. If you think about the lining in the lungs which exchanges oxygen and carbon dioxide, that's the epithelial tissue. So the epithelial tissues form the cover or the lining of the many organs, and they can be like a one single layer, or in case of skin, they can be multi-layer. And they are attached to something called, which will sort of simplify and call it extracellular matrix. Okay. Now the extracellular matrix is mostly composed of proteins like collagen, but they will also have some cells like some fibroblast cells, and there may be some blood vessels. But we are going to average we are not going to go into the detail of those things. We are just going to think from a material point of view. And for that, we have this epithelial cells, and they are connected to something which we call the extracellular matrix. Okay, and I have this image again and again so that you really understand that where exactly what exactly I'm talking about. So these are the epithelial cells, and this is the extracellular matrix being putting together. Now, given that, the idea here is that how the forces. So this talk will be divided in three parts. First, I'm going to talk about the forces in biology, about physics. Then I'm going to talk about a little about cancer. And then eventually, I'm going to show something that we are doing in our group related to the physics of cancer. So in the first, let us think about how the forces in biology operate. So if you look at the epithelial tissue like this, let's say I'm looking at something like this and sort of amplifying this, I can have two views to this problem. And these views can understand this problem from the physical point of view. And I can imagine that cells are connected to each other. And because they are connected to each other and they generate forces, they will be pulling onto each other. Okay, so they will apply. So if like many people are crammed into a room, so of course one individual will apply some forces on the neighboring individual. So this is sort of the fourth point of view. And another, so this will be this air will be the forces between two cells. And they're also going to be the forces. So you see this, our epithelial cells, they're connected to this extracellular matrix, right? So because of that, because they are generating forces, and these forces get transmitted through these junctions, through these connections, to the extracellular matrix. So there are forces over here. So all we can do, we can measure the forces over here and here, and try to draw some sort of free body diagram of this epithelial thing, and try to see that how far that picture sort of gets us. Okay. And then comes the conventional biological picture, which is the full of molecular details. And this molecular details generally goes like this: that X molecule binds to Y, and that binding activates Z. So you really do not have to pay attention to any of this molecule, but just know that which the line that what I'm representing here as a single line can be as complex as this one. Okay, so there is a layer of complexity, and what is represented here as a line can be made up of 50 different proteins. But if you are taking a physicist view, then you can very conveniently say that I don't care. It's just that I care that there are connections between two cell and vaccine. So this is how we can understand the same thing from a physical point of view and the biological point of view. So what is the advantage of that? The advantage of this, we can take the benefit of the both worlds. Because physicists, as a physicist, you can ask, can you find the rules and the laws of the biological event that you see? Okay? Because the physicists are very good at generalizing. One classical example is that the reason you know that that the apple falls and the earth revolves around the sun because of the same forces. So all of these things are apparently very complicated, apparently look dissimilar. They are no. Yes.
The people who are watching online are complaining that your voice is breaking. So someone is suggesting that you go live once again.
Okay. So I can repeat it.
There are 18 people. No. There are 18 people watching, so they have requested that the audio is breaking up.
Okay.
So if you could just give us 2 minutes to figure this out.
Okay.
Sorry, this is the first time we're doing it hybrid. So yeah.